everyone, I am Lantajo.
And I am Clarice Joy R. Dela Peña.
And we are the bulk stimulants magnesium hydroxide. Get to know me by first knowing my generic name, which is magnesium hydroxide, and my brand name, Milk of Magnesia.
This is the chemical name of magnesium hydroxide.
Drug classifications. Therapeutic, we belong to the mineral and electrolyte replacements or supplements, laxative, and antacid. For the pharmacologic, we belong to the saline laxatives.
My pregnancy category is category B because I am generally accepted for use during pregnancy. There are controlled studies in pregnant women showing no evidence of fetal risk. Use in nursing mothers appears to be safe.
Mechanism of action. As a laxative, I work by increasing the osmotic effect in the intestinal tract and drawing water in. This creates distension of the colon, which results in an increase in peristaltic movement and bowel evacuation. My suspension is ingested and enters the stomach. So according to the amount ingested, I will either act as an antacid or as a laxative. Through the ingestion of 0.5 to 1.5 grams in adults, I will act by simple acid neutralization in the stomach. My hydroxide ions from the magnesium hydroxide suspension will combine with the acidic H+ ions of the hydrochloric acid made by the stomach's parietal cells. This neutralization reaction will result in the formation of magnesium chloride and water. Indications. The magnesium hydroxide can be used as an antacid or a laxative depending on the administered dose. So, as an antacid, I can be used to temporary relief of heartburn, upset stomach, sour stomach, and acid indigestion. For laxative, I can be used for relief of occasional constipation by promoting bowel movements for 30 minutes and up to 6 hours.
Now let's go to my contraindications. I am contraindicated to patients with hypermagnesemia, hypocalcemia, anuria, existing electrolyte imbalance, appendicitis symptoms or acute surgical abdomen, myocardial damage or heart block, fecal impaction or rectal fissures, intestinal obstruction or perforation, and undiagnosed abdominal pain. I am also contraindicated to patients who are pregnant, active labor, or within 2 hours of delivery unless used to preterm labor. And also, use cautiously in any degree of renal insufficiency.
Let's proceed to the side and adverse effects. Along with the needed effects of magnesium hydroxide, we may also cause some unwanted effects. Although not all of these side effects may occur, if they do, they may need medical attention. Let's talk about the general side effects. The daily use of magnesium hydroxide can result in fluid and electrolyte disturbances. Also, symptoms of gastrointestinal irritation and/or watery diarrhea may occur. Symptoms of high magnesium levels, symptoms of dehydration, and symptoms of serious allergic reaction. Now for the adverse effects per body system. For the CNS or central nervous system, we may cause severe dizziness, mental or mood changes such as confusion. Respiratory system, slow or shallow breathing. For the cardiovascular system, we may cause slow or irregular heartbeat. Next is gastrointestinal, extreme thirst, very dry mouth, stomach or abdominal pain, bloody stools, rectal bleeding, abdominal cramp, nausea and/or diarrhea. Next is the muscular system. We may cause muscle weakness. For the genitourinary system, we may cause decreased urination. And for the integumentary, rash, itching or swelling, especially of the face, tongue, and throat. Also, flushing and sweating.
Some nursing responsibilities before administering me includes assess for possible contraindications and cautions, and history of allergy to antacids to prevent hypersensitivity reactions, renal dysfunction, which might interfere with the drug's excretion, electrolyte imbalances, which could be exacerbated by effects of the drug, and current status of pregnancy or lactation due to possible effects on the fetus or newborn. Next, perform a physical examination to establish baseline data before beginning therapy. Determine the effectiveness of the therapy and evaluate for any potential adverse effects associated with the drug. Next, inspect the abdomen. Auscultate bowel sounds to ensure GI mobility. Next, assess mucous membranes status to evaluate potential problems with absorption and hydration. Lastly, monitor laboratory test results including serum electrolyte levels and renal function tests to monitor for adverse effects of the drug and potential alterations in excretion that may necessitate dose adjustments.
Now for the during nursing responsibilities. These are the things that you nurses should remember. First, you should administer the drug apart from any other oral medications approximately 1 hour before and/or 2 hours after to ensure adequate absorption of the other medications. You should have the patient chew tablets thoroughly and follow with water to ensure that therapeutic levels reach the stomach to decrease acidity. Next, perform diagnostic testing. Obtain specimens for periodic monitoring of serum electrolytes to evaluate drug effects. Next, prevent imbalances. To assess the patient for any signs in acid-base or electrolyte imbalance to ensure early detection and prompt interventions. Next, institute a bowel program. Monitor the patient for diarrhea or constipation. To institute a bowel program before severe effects occur. Next, ensure adequate nutritional status. Monitor the patient's nutritional status if diarrhea is severe and constipation leads to decreased food intake to ensure adequate fluid and nutritional intake to promote healing and GI stability. Next, provide patient support. Offer support and encouragement to help the patient cope with the disease and the drug regimen. And educate the patient. Provide thorough patient teaching, including the drug name and prescribed dose, schedule for administration, signs and symptoms of adverse effects, and measures to prevent or minimize them, warning signs that may indicate possible problems, and the need to notify the healthcare provider immediately.
Aftercare nursing responsibilities. Number 1, monitor patient response to the drug. Relief of GI symptoms caused by hyperacidity. Next, monitor for adverse effects. GI effects, imbalances in serum electrolytes, and acid-base status. Next, evaluate the effectiveness of the teaching plan. Patient can name the drug and dosage, as well as describe the adverse effects to watch for, specific measures to avoid them, and measures to take to increase the effectiveness of the drug. And lastly, monitor the effectiveness of comfort measures and compliance with the regimen. So that's it for this video. We hope you learned something about the magnesium hydroxide drug.
Till next time, bye!